Good morning, sir. My name is Faria Khan and I am from Group 7. My topic for today's video is hernia. So, first, let's talk about what hernia is. A hernia is an abnormal protrusion of an organ or a tissue through a weak spot or opening in the muscle or connective tissue that normally contains it. There are many types of hernia such as inguinal hernia, incisional hernia, femoral hernia, hiatal hernia, and the umbilical hernia. The main causes are strain, cough, and weakness, and the common symptoms are pain, bulge, and nausea. In this video, we will be covering about the inguinal hernia in detail. Let's take a look at the parts of hernia first. There are three parts of hernia as you can see in the above image, that is the covering, content, and the sac. The sac includes peritoneum, the content includes intestine, and the coverings includes anterior abdominal wall structures, and there is also a opening. If we take a look at the posterior view of the anterior abdominal wall, we can see a triangle known as Hasselbalch's triangle whose medial boundary is made up of rectus abdominis muscle and the superior lateral boundary is made up of inferior epigastric artery, which is a branch of external iliac artery and is covered by lateral umbilical ligament, and the inferior lateral boundary is of inguinal ligament which extends from the ASIS, that is the anterior superior iliac spine, to the pubic crest, and the green dotted line which you see on the above image or figure is known as the medial umbilical ligament, which basically divides the triangle into two parts, that is the lateral part and the medial part. Now let's move towards the types of hernia. There are two types of hernia. First is the indirect hernia and the second is direct hernia. If we talk about the indirect hernia, the content in this herniates through the deep inguinal ring, travels the entire length of the canal and then exits through the superficial inguinal ring, that is the SIR. It arises from outside the Hasselbalch triangles, and the covering of this hernia includes skin, external spermatic fascia, cremasteric fascia, internal spermatic fascia, and the extraperitoneal connective tissue. As you can see in the above figure, the content herniates through the DIR and then exits through the superficial inguinal ring, that is the SIR, and hence it is called the indirect hernia. The second one is direct hernia. In this, the intestine directly pushed through a posterior weakened wall of the canal and takes the posterior wall of the canal with it. It arises from within the Hasselbalch triangle. As you can see in the above figure, the intestine is pushing through the weakened posterior wall and not from the deep inguinal ring, and then taking the exit from the superficial inguinal ring. Hence, it is called the direct inguinal hernia. Direct inguinal hernia also has two types. First is the lateral direct hernia and the second is medial direct hernia. If we talk about the lateral direct hernia, it arises from the lateral part of the Hasselbalch triangle, and the contents include skin, external spermatic fascia, cremasteric fascia, fascia transversalis, and the extraperitoneal connective tissue. And the second one is medial direct hernia. It arises from the medial part of the Hasselbalch triangle, and the contents include skin, external spermatic fascia, conjoint tendon instead of cremasteric fascia, fascia transversalis, and extraperitoneal connective tissue. Lastly, let's talk about the mechanisms of inguinal hernia. These are the normal mechanisms to prevent the occurrence of hernia. So there are four types of mechanism. First one is flap valve mechanism, second is shutter mechanism, third is ball valve mechanism, and the fourth and the last one is slit valve mechanism. In ball valve mechanism, it refers to the oblique nature of the inguinal canal. This canal is straight in kids and gradually becomes more oblique according to the age. Thus, when the intra-abdominal pressure increases, anterior and posterior walls approximately decreases in space. The second one is shutter mechanism. In this, the IOM, which is the internal oblique muscle, having the triple relation anterior wall, roof, and the posterior wall. Thus, the IOM contraction leads to the narrowing of the canals from these sides, and this can be compared to the shutter. Third one is ball valve mechanism. In this, contraction of the cremasteric muscle pulls the testis upward, This corrugates the cremasteric fascia around the SIR and plugs it. And the last one is slit wall mechanism. Due to the external oblique aponeurosis attached to the lateral and medial crura, contraction of EOM pulls on the crura, thus increasing the structural integrity of the SIR and the canal with it. That's all about the hernia. Thank you.